Welcome to Video 2, Roles and Responsibilities. The purpose of interprofessional education is to help students learn how to work as part of an effective interprofessional collaborative healthcare team. In 2011, the Interprofessional Education Collaborative, also known as IPEC, released 4 interrelated core competency domains for interprofessional education. These interprofessional education competencies were developed to better prepare health profession students to deliberately work together to meet the common goal of developing a safer and more patient-centered care system. This video will be addressing the second competency domain, which is to use knowledge of one's own role and those of other professions to appropriately assess and address the healthcare needs of patients and populations served. For students to achieve this competency, they must demonstrate how they use their knowledge of the professional role and responsibilities, as well as the role and responsibilities of the other healthcare team members involved to deliver optimum patient-centered care. This is an action-oriented competency which cannot be achieved just by reading about the different health profession roles. At the end of this training video, you'll be asked a short series of questions about this competency to help assess your understanding of the competency presented. To address this competency, a helpful starting point is to understand what our respective healthcare professions have in common and what is unique. These questions are not as easy to answer as you would expect. Many of our ideas are based on personal experiences and stereotypes. Another challenge is that different healthcare teams are made up of different health professions, depending on the context. Who is part of the healthcare team always includes the patient, along with a variety of health professionals, but often the healthcare team also includes others, such as informal caregivers, medical assistants, and community lay health workers. Regardless of who's on the healthcare team, it is the ability to work together and understand how each is contributing to quality care that is important. We're going to focus on the roles of a sample healthcare team, which for this video includes medicine, nursing, pharmacy, and social work. Keep in mind that the patient and family are always an integral part of the healthcare team. So now we're going to hear from each healthcare professional on our team to see what they identify as their unique contribution or perspective that contributes to the healthcare team, and to also begin to develop an understanding of their role in its entirety, so that we can identify how the different health professions may be similar.
A physician's unique role focuses on performing a history and physical to determine a differential diagnosis for the patient, including most likely diagnosis, and then developing management and treatment plans for those conditions and diseases. The role of the physician on a healthcare team is multifaceted. Their responsibilities are based on their regulated scopes of practice. The physician is trained to provide leadership in developing and supervising the patient's overall healthcare plan. A physician's role can be divided into 5 general areas. 1. Perform medical histories and physical examinations to determine a possible diagnosis for both acute and chronic conditions. Diagnosis is a key feature of a physician's expertise in medical practice and is based on strong assessment skills. Diagnosis is a core cognitive skill based on both knowledge and judgment. 2. Provide continuous care for the patient while in the hospital or ambulatory setting. They manage and treat a variety of medical conditions from minor cuts to mental health problems to palliative care to surgery. They are required to manage complexity and risk in situations that oftentimes are uncertain and changing. 3. Works collaboratively with the healthcare team to provide optimal care. This includes providing referrals to other practitioners or services that the patient may need, along with providing updates of the patient's condition and needs to other services such as physical therapy, home health services, and other specialists. 4. Provide education to patients, families, and support staff as it relates to the patient condition, diagnosis, and treatment. The physician will offer resources with information and research that patients can use to make informed decisions about their treatment plan. The physician will often teach medical students, residents, physician's assistants, advanced practice nurses, and others about this area of expertise as well. 5. Advocates for patients and family. They help the patient navigate through a complex medical system to be able to obtain the most patient-centered care in a cost-effective manner. The physician works to meet the needs of the individual patient, the practice population, and the community by working with a variety of partners in the community, public health sector, and hospital system.
The registered nurses, or the RN, unique role on the healthcare team is the ongoing assessment of the patient's health status and the patient's response to their plan of care. For example, in the hospital setting, the registered nurse is often the healthcare professional who spends the most time directly with the patient, providing around-the-clock observations and care. The registered nurse is responsible for implementing the physician's orders, such as giving medications or changing dressings, and assessing the client's response to the treatment plan. The nurse is also responsible for evaluating the safety of the medical plan of care before implementing it. Nurses critically interpret patient information and assessment data to make decisions about what actions are needed. The nurse focuses on helping patients meet their needs, including physical, emotional, cognitive, social, and spiritual needs. This includes working with the healthcare team to develop and implement the best individualized, evidence-based plan of action and care for the patient. Nurses are patient advocates and facilitate optimal health, functioning, and wellness in the care of individuals, families, communities, and populations. Another important component of nursing care is patient education and coaching. Nurses work with patients and the healthcare team to assist patients in learning how to manage their own health. This includes addressing such topics as healthy lifestyle choices, coping with a diagnosis, or understanding warning signs and symptoms of emerging problems. The role of the nurse varies depending on the setting and the type of nurse. For example, the healthcare team may also have an advanced practice nurse who has expanded knowledge and skills in a specific area after additional graduate level education. Many advanced practice nurses have collaborative practices with physicians. Advanced practice nurses include nurse practitioners, clinical nurse specialists, nurse midwives, and nurse anesthesiasts. Some advanced practice nursing activities overlap with physicians since advanced practice nurses can perform select medical therapies. However, advanced practice nurses also continue to use their nursing knowledge with a unique focus on addressing symptoms such as fatigue, discomfort, itching, and functional problems such as difficulty swallowing, skin breakdown, and decreased mobility.
A pharmacist's unique role is in ensuring the safe, effective, and appropriate use of medications. This involves assessing the patient for medication-related issues, collecting and interpreting the evidence, prioritizing the patient's needs, recommending, implementing, and monitoring and adjusting the pharmaceutical care plan. Pharmacists work collaboratively as members of an interprofessional healthcare team to provide patient-centered care by functioning as a medication expert. For example, the pharmacist would evaluate a patient's drug therapy for appropriate indication, safety profile, drug interactions, and interactions with other consumed products such as food and alcohol, and a patient's response to drug therapy. Pharmacists practice in a wide variety of settings: inpatient, ambulatory care, nursing homes, managed care organizations, pharmaceutical companies, pharmacy benefits management companies, colleges and schools, the federal government, and other public health entities. Some pharmacists work directly managing the medication use system, which includes procuring medications and related items, ensuring proper storage of medications, and prescribing, transcribing, dispensing, monitoring, and documenting these pharmacy activities. Examples of pharmacists involved in the medication use system include those who work in a retail pharmacy or in a hospital pharmacy. In certain states and healthcare systems, pharmacists are authorized to function as providers with prescribing authority under supervision. Pharmacists obtain certification to administer immunizations, conduct medication therapy management, and become certified diabetes educators. Pharmacists can also seek board certification in specialty practice areas such as pharmacotherapy, ambulatory care, psychiatry, oncology, nutrition, infectious disease, and nuclear pharmacy. Examples of other areas of practice include quality and patient safety, critical care, emergency medicine, transplant, pediatrics, and geriatrics. Similar to most healthcare professionals, pharmacists contribute to the health and wellness of individuals and communities. We participate in activities that promote health and disease prevention, such as health screens at health fairs, and educate the public on a wide variety of health and medication-related areas. As an integral member of the interprofessional healthcare team, pharmacists, like all other healthcare professionals, serve as patient advocates. We deliver care based on evidence and centered on the needs, values, and culture of our patients. The ability to collaborate and communicate effectively as an interprofessional team is essential to improving health outcomes and delivering quality and safe care to our patients.
Social workers are licensed mental health professionals specifically trained in understanding the unique psychosocial needs of the patient and family in their unique sociocultural context and environment. Social workers are the integrated behavioral health specialists on the interprofessional team. Social workers work closely with patients and their families to assist them in understanding, navigating, and coping with illness with the larger healthcare system. They provide empathy, listening, intervention, and support to patients and families. Social workers play a critical role in psychosocial assessment, distress screening, facilitated decision-making, care coordination, navigation, and understanding the patient and family needs in their cultural and social context. To that end, they may represent and give voice to the unique patient experience and how that influences their illness and recovery. Using their extensive knowledge in systems theory, crisis intervention, family therapy, evidence-based interventions, cultural competence, clinical intervention, and development needs across the lifespan, they can offer a comprehensive psychosocial assessment and care plan for the team. Social workers are advocates for patients and families. They empower patients and families to work closely with their healthcare providers to get the services that they need. They may help the larger interprofessional team consider the psychosocial needs of the patient in their family and community. They may provide education about coping responses in the face of illness, injury, grief, or trauma. Social workers provide support, counseling, diagnosis, and intervention to patients, families, and communities. For example, they may offer support for coping with illness, mental health counseling around specific issues, diagnostic assessment of mental health concerns, evidence-based interventions, and behavioral health change strategies. Social workers also play an important role in end-of-life decision-making and grief and bereavement support. Social workers often serve as the care coordinators, bringing together the healthcare team and the family to facilitate family care conference or to coordinate needed community resources and information. These activities are critical to ensure that the patient is getting the most patient-centered and coordinated care possible. Social workers are an integral part of the interprofessional healthcare team and may play multiple roles depending upon the setting. Some examples that illustrate the diversity of their roles include social workers playing the role of ethical consultant to the team or to the larger healthcare system, social workers filling a communicator or translator role, helping the patient and family and healthcare team to better understand each other. Social workers can assist families with resources related to poverty, homelessness, domestic violence, immigration, child abuse and neglect, and elder care.
We, the healthcare team, have a common goal of providing patient and family-centered care focused on delivering the best evidence-based interventions to promote health and well-being. Ideally, these interventions would optimize patient, family, and community outcomes.
These evidence-based interventions are determined by collecting and interpreting assessment data. All members of the team are involved in assessment, but the focus of the assessment may vary from one healthcare profession to the next. If we all did the same assessment and all had the same focus, we would lose the advantage of the team approach, which is strengthened by our diversity.
To meet this common goal, the team functions as the patient and family advocates, as do each member of the different health professions.
While it is obvious that evidence-based and patient-centered care is the main function of the interprofessional healthcare team, there are several other key areas in which specific roles and functions are shared by all members of the team. These include sharing accountability for the plan of care, providing patient education and counseling, helping the patient navigate the healthcare system, and promoting health and wellness.
This information about the similarities and differences among the healthcare professions provides a foundation that is necessary but not sufficient to address the second competency domain, which is to use knowledge of one's own role and those of other professions to appropriately assess and address the healthcare needs of the patients and populations served. Let's talk to our healthcare team from the scenario in the first video about how this competency domain can be applied. Each healthcare team will be different and context-driven. Remember, the scenario centers around Ella, a 78-year-old woman who, in collaboration with her healthcare team, had decided to stop further cancer treatments and transition to palliative medicine and symptom management control. Ella has been working with her interprofessional collaborative team for 2 years. Her daughter Karen lives out of town and is not supportive of the decision. Her daughter is visiting her mother for the purpose of reversing her mother's decision and resuming chemotherapy. Let's meet our team members. In addition to Ella, our patient, and her daughter Karen, there is Dr. Young, the oncologist who specializes in breast cancer, Jose, the oncology clinical nurse specialist, an advanced practice nurse who works with cancer patients to manage symptoms, Andrea, the oncology social worker with advanced training in mental health and psychosocial oncology, and Dr. Lee, the oncology pharmacist with experience in palliative care.
We've been working together as a healthcare team for about 3 years now. In an interprofessional team, accountability for the patient's plan of care is shared.
We all love working with oncology patients, and that common focus has really helped the team gel.
Yes, but when we first started working together, we were not exactly a well-oiled machine. It really took some time for us to figure out how to work as a team, to figure out not only what each of us brought to the table from our unique healthcare professions, but also our strengths and weaknesses as individuals. It really helps to know your own limitations.
Frankly, it is a relief to have a whole team working with the patient and family. Our patients are very complex, and there's no way one person could efficiently and effectively handle the plan of care. And even this team isn't enough. Depending on the patient's needs, we often have to call in other resources as well, like physical therapy or the clergy.
That's right. The team meetings are really helpful to formulate the plan of care, making sure we have all of the patient's needs covered. But just as important is clearly communicating who's going to do what. We need to be clear what each team member's role is going to be in executing the plan and making sure it's communicated to the patient.
Right. Without that communication, things wouldn't go as smoothly. For example, you may have overlap. Like Andrea and Jose might both call to arrange a consult for PT. Or worse yet, you may have gaps where you think someone else is taking care of the consult, but it doesn't get done. So the communication is the key to the team being able to successfully provide healthcare that is safe, timely, efficient, and effective.
We especially need to negotiate the roles we have in common. Each of us are capable of helping the patient navigate the healthcare system. So, who should take that on in the team? Well, it depends on the situation and the team. It might be a matter of who has time to do it, or who has the best relationship with the patient and family, or, going back to personal strengths and limitations, who enjoys doing it and does it well. Either way, it should always be negotiated by the entire team.
You know, this is one of my favorite parts. I feel like a star. I'm being cared for by all of you, and I appreciate all of the help and the guidance that you've all given me. I especially like the fact that I know what I can expect from each one of you in my care. Thank you very much.
The other advantage of our team is that we help each other to achieve the best team performance. Whenever we go to a conference or read a journal article that would be useful to the team, we share it so that our team can be the best it can be and provide the optimum care.
I wish I had had a health team like this that could follow me all the way through my entire life and all the plans laid out for you as you enter each step of your journey. This is wonderful. Thank you.
Let's examine what we saw illustrated in the team meeting scenario that applies to the roles and responsibilities competency along with its subcompetencies. When we look at the specific roles and responsibilities subcompetencies, the heart of this competency is to meet the healthcare needs of the patient and population served, which can be best done by the healthcare team with its diverse areas of expertise. 3 of the subcompetencies address this issue. Subcompetency 3, engage diverse healthcare professionals who complement one's own expertise as well as associated resources to develop strategies to meet specific patient care needs. Subcompetency 5, use the full scope of knowledge, skills, and abilities of available health professionals and healthcare workers to provide care that is timely, safe, efficient, effective, and equitable. Subcompetency 9, use unique and complementary abilities of all members of the team to optimize patient care. In our scenario, Dr. Young expresses the value of the healthcare team in optimizing patient care. She says, frankly, it's a relief to have the whole team working with the patient and family. Our patients are very complex with multiple needs, and there's no way that one person could efficiently and effectively handle the plan of care. Additionally, it is recognized that the team may need to call in other resources as well, like physical therapy or the clergy, depending on the patient's needs. Several of the subcompetencies for roles and responsibility competency center around communication. Subcompetency 1, communicate roles and responsibilities clearly to patients, families, and other professionals. Subcompetency 6, communicate with team members to clarify each member's responsibility in executing components of a treatment plan or public health intervention. And subcompetency 4, explain the roles and responsibilities of other care providers and how the team works together to provide care. In our scenario, the team talks about team meetings being one way to not only formulate a plan of care, but also clearly communicate who is going to do what. Clarifying what each team member's role is in executing the plan and making sure that it is communicated to the patient. This communication is key in preventing overlaps and gaps in implementing the plan of care. Evidence that the roles and responsibilities for each team member is being communicated to the patient was illustrated by Ella commenting, "You're all really good at letting me know exactly what I can expect from each of you." For the subcompetency 2, recognize one's limitations in skills, knowledge, and abilities. This requires insight and knowledge of self. Since there is a great deal of overlap between different professions, sometimes understanding one's limitations as well as strengths can help the team know who needs to implement what part of the plan of care. In the example given our scenario, helping the patient navigate the healthcare system is part of the role for all the professions on this team. So in our scenario, Andrea talks about the need to negotiate and be clear on the roles that we have in common. Who implements what when more than one team member is capable depends on the situation and the team. Although it might be an issue of who has time to do it or who has the closest relationship with the patient and family, it may also depend on personal strengths and limitations, who does it well and enjoys it. So recognizing one's limitations is essential to optimal care. The last subcompetency for roles and responsibilities are forge interdependent relationships with other professions to improve care and advance learning, and engage in continuous professional and interprofessional development to enhance team performance. The healthcare team in this scenario illustrated these subcompetencies improving team performance and care by sharing information of interest to the team from conferences and journal articles. For more information on the IPE competencies, they can be accessed by the website on the screen.